Welcome back. My name is Lucy. I'm a pharmacist and a nurse, and in this video we'll talk about beta blockers, how they work, how they're classified, and their uses. How do beta blockers work? They work by blocking the action of hormone adrenaline or epinephrine and noradrenaline or norepinephrine. In your body, you have adrenergic receptors, which include beta 1 and beta 2, alpha 1 and alpha 2, and they are located on the cells of tissues and organs throughout the body. These receptors are responsible for signaling in the sympathetic nervous system. I have included a table to show where all these receptors are located in your body. In this video, we'll be concentrating more on the cardiac cells. The hormone epinephrine and norepinephrine makes the heart beat faster and with more force. By blocking these hormones, this make your heart beat slower and with less force, which reduces your blood pressure and the strain on your heart. Beta blockers are classified based on generation or the effect they have on the adrenergic receptors. First generation are non-selective beta blockers. These beta blockers block beta 1 in the heart and beta 2 receptors in the lungs. In the heart, they decrease the heart rate and cause vasodilation, which in turn reduces your blood pressure. In the lungs, they cause bronchoconstriction. Therefore, these beta blockers are contraindicated in patients with asthma and COPD because they can exacerbate shortness of breath. These beta blockers include Nadolol, Propranolol, Timolol, Pindolol, and Sotalol. Second generation are beta 1 selective at low doses, which means they mainly work in the heart, but at high doses, they can block beta 2 in the lungs. These include Atenolol, Esmolol, metoprolol, acebutolol, and Bisoprolol. Third generation beta blockers are non-cardio-selective, which means they block beta receptors in the heart and the lungs, and also they block alpha receptors in the vascular smooth muscles. Vascular smooth muscles are found in hollow internal organs such as blood vessels, bladder, uterus, and GI tract. These beta blockers include carvedilol and labetalol. The last class is a mixture of first, second, and third generation, but they have intrinsic sympathetic activity. What this means is that they have partial agonistic effect at beta 1 receptors and can cyclically stimulate the heart and increase the heart rate. These beta blockers are preferred in patients who are prone to develop severe bradycardia with beta blocker therapy. They include Pindolol, acebutolol, pentobuterol, and labetalol. Here is a table with a summary of the last few slides. What are beta blockers indicated for? They are indicated for cardiovascular diseases like hypertension, angina, which is pain in the chest that is caused by inadequate blood supply to the heart, arrhythmias like atrial fibrillation and tachycardia, heart failure, and post-heart attack care because it can help protect the heart from a second heart attack after a first heart attack. Beta blockers are also used for certain type of central nervous system disorders, including migraine prophylaxis, anxiety, and essential tremors. Beta blockers also have endocrine indication for hyperthyroidism and pheochromocytoma. Pheochromocytomas are tumors that develop on the adrenal glands, which the adrenal glands are two small organs that sit on top of your kidney. Some symptoms of pheochromocytoma include high blood pressure, sweating, rapid heart rate, and headache. Beta blockers can also be used for glaucoma. Thank you for watching. Like, share, and subscribe if you found this information helpful.